I'd like you to know a little bit about my background and why I've chosen to be cross trained to gain wisdom and insights from a variety of different places. When I look back, I was very fortunate to have been in the MD PhD 6-year medical program at Boston University. I added a PhD in biochemistry and general medical science under Karl Franzblau. And on one day in 1972, I received an MD, PhD, and Bachelor of Science degree, 3 degrees on one day. Then I was very fortunate as a student to be in the lab of Dr. Dan Dakin at Beth Israel Hospital in Boston. And he and I studied how the molecule collagen, the connective tissue essential molecule protein collagen, activates platelets. And that was published in JCI, Journal of Clinical Investigation. I then did internal medicine training at University Hospital under Norm Levinsky, and that was a privilege. Along the way, because of my ethnic orientation, I also was immersed in Jewish religious studies. The Rav, Joseph Soloveitchik, the Bostoner Rebbe, Levi Horowitz, the Talna Rebbe, Dr. Rabbi Twersky, and many, many other scholars in the Boston, Brookline area introduced me to an entire world of medicine based on the Jewish Talmud. Then I was very fortunate to be allowed to be first a resident and then in charge of the residency program at the clinical center of NIH in clinical laboratory medicine called clinical pathology. I have boards in both clinical pathology and chemical pathology. And I was on the permanent senior staff at NIH. And each year we introduced an improved method to allow physicians and clinicians to help rather than harm. Along the way, I had 7 years apprenticeship with Qing Wu in Chinese medicine and acupuncture. Because Qing Nuan Wu could put needles into people and get results that we couldn't get at the clinical center. And I felt obliged to study anyone who had a system that helped rather than harmed, especially if it was relatively non-invasive. Then I heard about Dr. Ramamurti Mishra, who had written the textbook of yoga psychology and commentaries on Patanjali Sutras, and he was an MD, PhD, not too far away. And I had 5 years with him in Ayurveda and yoga. And then I met a Cambodian Buddhist monk, Bhante Dharmawara, who I now acknowledge as my principal mentor and teacher. And I had the last 30 years of his life with us together. And he introduced me slowly and methodically to a way of living that we now call Nature's Alkaline Way and Nature's Pharmacy, that has to do with lifestyle, epigenetics, and habits of daily living. He was a mentor. He was a model. He didn't preach so much as he demonstrated in practice. Many people have told me that a few minutes with him and a few words from him improved and changed their life. My imam in the Muslim world was Abdulaziz Saeed, head of the Sufi Order of the West and a professor for half a century at American University in Peace Studies. I've had the privilege of having a number of fairly well-acknowledged scientific reviews and peer-reviewed publications and chapters and other contributions to let people know the facts of today, not what we thought before. We've studied type 1 and type 2 diabetes. We studied fibromyalgia. We have many case successes. of this integrative, comprehensive, natural first, nature's pharmacy before pharmacology. I'm not opposed to anything that is beneficial and we know how it works and the safety for the individual of that. And it turns out it's mostly nature, nurture, and wholeness and physiology before pharmacology. This in part is exemplified through our Health Studies Collegium Foundation and our PIH Academy certification program, which has been going on for years. In a synthesis, in essence, I'm doing my best to save my own life and, by example, save yours. The concept we have is called Tikkun Olam, that is Hebrew for save the world. And very specifically, it's pointed out in the Jewish Talmud that if you save one life, you have saved the world. Life is interdependent. Life is meant to be a pleasure. Life is meant to be based on what we eat and drink, think, and do. And my cross trainings have taught me a good deal about functioning younger than your chronology. Every 6 months, I have my predictive biomarkers measured, and I am mostly functioning at half my biological age. At the age of 106, we had Bonte tested from stem to stern, and I presented the information to him. He looked up at me and he smiled and he said, 40's a good age. If you can feel and function like you're 40 when you're actually 106, that's an accomplishment. He's an example, and I've had the privilege of studying others, who reached a peak and maintained it, or reached a peak in their life and got sick and then got well, and were able to maintain a high level of functional performance for their entire lifespan. Aging is really an illusion of too much bad and too little good. I want you to take in more good and less bad, and therefore function much below your chronological age. Now, I have been fortunate to be cross-trained. I've been curious and interested in understanding wisdom and science from many different perspectives, all of which now come together in our Nature's Pharmacy and Nature's Alkaline way so that you can benefit today from the half century in medicine and science that I've had the privilege to immerse myself in. So I'd just like you to understand why my cross training leads me to different evidence-based conclusions, and I am confident over this time that in most cases, I have said things years to decades before others that have then been confirmed over time. So my suggestion is pay attention to our Nature's Pharmacy, to DrJ and his YouTube channel, Dr. Russell Jaffe, and our website, drrusselljaffe.com. We don't require you to learn Sanskrit or some esoteric language. We translate everything into English, into common sense, and to something you can do and practice, because as you get healthier, people around you will get healthier. And as you slip down the slippery slope of chronic disease, the people around you will become more chronically unwell. This is a remarkable interrelationship, interdependence of all life. So may you be well and happy, joyful and vital, functioning well below your chronological age, in part because I've been a curious character.